Yeah, 18 years old, outside in the cold, but where I wasn't better than the stormy weather. Thought I was alone till I found a new home, and what I was giving up treasure nothing else can measure. I found a place that told me I could stand on my own, make something for myself, and it was always inside me all along. Now I'm spreading the good, and I thank you for all of your help. And it's still raining,
Okay.
but I can't feel it no more since you opened your door for me. And it's still pouring, but I'm safe in my bed, 'cause I got a roof on my head. Finally, I can sleep. You gave me peace. Thank you for what you've given me. Thank you for believing in me. Thank you for what you've given me. Thank you for believing in me. Thank you for what you've given me. Thank you for believing in me. Finally, I can sleep. You gave me peace. You gave me peace. Now it's my turn. Carry on the lesson learned. I gotta share my blessing. It's time to send a message. There's so many like.
Good afternoon, everyone. Happy Black History Month. Throughout our history, the YMCA has worked to meet the ever-changing needs of our diverse communities and provide a place where people of all backgrounds can gather to create positive social changes. The Y has been privileged to support African American leaders who have moved our country forward. As we come to the end of the observance of Black History Month, I wanted to share some reflections regarding the health and race disparities that have deep roots in our nation's history when it comes to African American, African descent populations. It is always important to see how far we have come, as these moments can give us perspective on why and how historical trauma has led to the mistrust that exists in our communities today. Reflecting also serves a reminder that there's still much work to be done to address health disparities. My name is Rahel Schwartz, and I'm the Healthy Living Director at the Meredith Matthews YMCA, and I serve as a board member and a chair for the Health Council at the Ethiopian Community Center. I'm excited. I'm so excited to the YMCA to hear this afternoon and to have the opportunity to introduce our guest speaker, Dr. Stephaun Wallace. Dr. Stephaun Wallace is a researcher, epidemiologist, and an expert in developing, implementing, and evaluating major public health and human service programs in the areas of prevention, care, and treatment of HIV, AIDS, and other infectious disease globally. He's the director of external relations of both the HIV Vaccine Trials Network and the COVID-19 Prevention Network. Dr. Wallace leads the network's external relations strategies and efforts globally with a focus on building long-term relationships with key stakeholders. An internationally recognized leader and speaker in public health and social justice, Dr. Wallace has more than 2 decades of experience in sexual and public health, social justice, and community mobilization with diverse populations globally. He views public health work through a social justice lens to understand how population-level health is affected by structural and social factors like stigma, racism, sexism, historical trauma, and inequalities in education and income. We are so grateful for his presence among us today. Without further ado, please join me in welcoming Dr. Stephaun Wallace. Dr. Wallace?
Hello, hello.
All right. Dr. Wallace, to begin our conversation, I would like to start with frequently asked questions about COVID-19 vaccine. And the first question is, what are the ingredients in COVID-19 vaccines?
Hopefully you can hear me.
We
Okay,
can hear you.
awesome. Thank you again for the invitation. Always a pleasure to work with you, of course, and to support the Y. So happy to be here. The information or the ingredients for the vaccines are available in the FDA documents, but I guess to sort of say simply that we're looking at the messenger RNA as being one of the primary components or ingredients. And then there are these sort of lipids that encapsulate the messenger RNA code. And these lipids are laboratory manufactured sort of shells, if you will. And then there are some salts, is how I would characterize it. And part of this is to support our pH balance so that the vaccine is as close to the pH level as our bodies, so that when it's given to us, it doesn't cause any additional reactions. And also some sugars, which help to sustain the vaccine product until it does its job. So.
And I know this is one of the major question for a lot of people. How do we know that the vaccine is safe since it was developed so quickly? And if it was enough time to ensure it will be safe and not cause any long-term harm?
Sure. That's a really good question. There were, sorry, my mic muted for some reason. There were 3 phases of research done for each of the vaccines that's being considered. So, well, for the ones in phase 3. So let me start by saying that there were over 150 vaccines that were being looked at initially. So that's a massive amount of, number of vaccines. And so from that number, there were only some that made it past the phase 1 trials. The phase 1 trials were trials looking at a couple of 100 people, 100 people or less sometimes. And the specific purpose of those studies is to look at safety. What is this vaccine going to do? Is it going to negatively impact people? Is it going to cause harm? So that's the first phase. After the pharmaceutical companies got the data from that study, they provided it to the FDA, who then either gave them the green light to move forward or not. For the vaccines that move forward, they move forward into what's called a phase 2 trial. And in this trial, they looked at safety, of course, but also they looked at, does the vaccine give us the kind of immune responses that we think are necessary to make it effective? One of the other things that's looked at in the phase 2 trials are the dosing, looking at different doses and making sure that we're thinking about the right dosing for this. So again, the companies provide that information to the FDA review panel. The panel says, yes, it can move forward, or no, it cannot. So for the ones that move forward into phase 3 trials, those trials looked at enrolling more than 30,000 people into those studies. And in addition to safety, they're also looking at, do the vaccines work to prevent severe illness that may lead to hospitalizations and deaths? So the data came back from those trials. The FDA reviewed it in addition to other external review parties. And the determination was made for the Moderna vaccine and the Pfizer vaccine that both of those were not only safe, but that they were also effective at preventing illness, severe illness. So those are the studies and how they sort of flow. That process is typical for how product development happens in clinical trials, and none of those steps were skipped as part of this process. So, part of how we were able to get here so quickly is because the way that the vaccines were designed utilized a strategy that is not really new to the development process. We've utilized these strategies in other diseases with other products. And because the federal government invested a ton of money, billions of dollars in resources to help develop the manufacturing of these vaccines at risk. And what do I mean by that is typically, products are manufactured after they reach the phase 3 level and they show that they have some effectiveness in working. Well, the federal government invested in the manufacturing of these vaccines early on in the process, earlier than what we typically do. So that ensured that those processes were able to move forward, in addition to some of the red tape that's typically in bureaucracy. Many people are familiar with bureaucracy. So some of the bureaucracy that's typically involved in this process was harmonized. And so, that kind of red tape, we didn't have to deal with that kind of red tape because there was a lot more collaboration happening. So.
Thank you for answering so elaborately.
Sure.
And do we know how long does protection from a COVID-19 vaccine last? And also if it is safe for pregnant women to get it?
Sure, two great questions. So, duration of protection is something we're still looking at the moment. And that's something that we hopefully will have an answer to very, very soon. And then as soon as, of course, we have that information, we'll share it out. But right now, the obvious need is to prevent people from getting seriously ill and dying as a result of the disease. So, getting people vaccinated and addressing the concerns and questions that people have that can support vaccination is really critical. In terms of pregnant persons, the way the trials were designed, people who were pregnant would not be eligible to enroll. However, there were people who became pregnant as a result of, as a function of, during the process of being enrolled in the study. So we do have some limited data on people who became pregnant who also received the vaccines. And so that data, in addition to the recommendations from leading researchers and healthcare practitioners involved in pediatrics and gynecology, have suggested that people should be vaccinated if they are pregnant. So this is the recommendation that's been provided by the top physicians and doctors in these areas.
Thank you. One last question from me before we open the floor for the audience is, if someone had COVID-19 and recovered, do they still need to get vaccinated? And also, do they need to get both doses, or do they just need one of the dose?
That's a really, really good question. So what we know is that after a person acquires the virus, SARS-CoV-2, that's the virus that results in COVID-19, that our bodies produce, we have an immune response and produce antibodies to it, of course. The antibodies, however, that we produce naturally don't seem to be enough to really work to protect our bodies fully in all instances. And the duration of those antibodies tends to be really short. So because of that, people are advised to get vaccinated, even if you've had COVID-19, in addition to the fact that, you can get the disease multiple times. So, it's really important to think about this not being like, you get it once and then you're done. You can get it again and again. And so getting the vaccine will really help to ensure that you don't develop the serious illness associated with the disease and wind up in the hospital, again, potentially on a ventilator, et cetera. So this is really, really important. Really good questions.
Thank you, Dr. Wallace. At this time, I would like to open the floor for questions. Please drop your questions in the chat box, and Miller, my colleague, will be monitoring the chat, and we'll go from here. Thank you, Dr. Wallace.
Sure.
Thank you both. The first question that we have is, what are the best ways to get involved with volunteering to ensure equitable access to the vaccines in the Black community in Seattle and King County? There's a multiple part question, so I'll start with that and then read the next part of the question.
I see. That is a really good question. There are several groups that are working on this access piece. The county health department, King County Health Department is working on it. Of course, the city of Seattle is working on it as well. And our colleagues at the Washington State Department of Health are doing this. And so there are, lots of opportunities. There are different churches that are doing work on this. ARTH, one of the local community-based organizations, is doing some work on this. The Somali Health Board is involved as well. So I think connecting with any of those entities would help sort of get you connected for sure. And if you have additional questions, please feel free to reach out to me as well. I'm happy to figure out ways to connect people to this.
Thank you. The next part of that question is, are there any groups that are organizing rides for the elderly, helping to schedule visits for those who are not as technologically literate, et cetera?
I'm not entirely sure. That's a level of nuance and detail that I don't have an awareness of at the moment, if I can be honest. So,
honesty is the best policy. Thank you for that. The next question is, what is the latest information with the Johnson & Johnson vaccine? Where is it at in its clinical trials?
Yeah, I wanted to sort of continue a comment from the last question to say that it is really important that we think about getting people connected and getting people vaccinated who may not have technology, right? Who may not have the smartphones and the computers and internet. And so thinking about different strategies to support people getting access to the vaccine is really critical. And one of the reasons why community-informed solutions in this is really, really important. So to sort of jump back to the question prior to that, Miller, I think it's really important that communities are actively engaged in these conversations and working with organizations to really think through how to do this to make sure that this is being done from an equity perspective and that no one is being left behind.
Thank you for that.
In terms of, I'm sorry, the other question was about the Johnson & Johnson vaccine?
Correct.
Yeah, so the Johnson & Johnson vaccine is actually being reviewed today by the FDA review panel. So hoping to hear more details about that following the review meeting. There's been some press about it already about, some numbers. So really looking forward to getting the review panel's feedback and figuring out whether this would be another one we can move forward with. One of the features of the Janssen vaccine or the Johnson & Johnson vaccine that I think are worth noting is that it doesn't have the same sub-zero degree cold sort of temperature storage requirements that the Moderna and the Pfizer vaccine have, which would, I think, help to support getting more community vaccination centers going and supporting, even mobile vans going around and providing vaccines to communities. Again, thinking about the equity issue and people who may not have access to technology. And also thinking about that it's one shot, so it's one shot versus two shots, which is, for Moderna and Pfizer is two. So the Janssen or Johnson & Johnson vaccine is just one. So there's a consideration there as well that I think is important to note.
Thank you for that. Another thing, we just want to make a note that the Y is also organizing vaccine education and mobile vaccine clinics for African-American and African-born populations. And so we'll be sharing information throughout the chat and also at the end if folks are interested in volunteering or getting involved with that work as well. Thank you so much for those responses, Dr. Wallace. Another question, when will the vaccine be available to children or younger adults?
That is an exceptional question. So we need to do the trials in adolescents and children. So when those trials happen, hopefully you can see my background better now. So when those trials happen, then we'll get some data on that. But, typically in product development, studies are done in adults first because children are considered a much vulnerable population. So those trials should be happening shortly if they've not already started. And looking forward to getting, like I said, the data on that. Because I know lots of people are not just interested in protecting the health of their children, but also wanting to make sure that, we can get kids back into schools and other activities. So.
Thank you for that. What other background information or things that are coming up that you've seen, particularly in the Black community?
Can you say a little bit more about that?
Just more or less things that are coming up that you're seeing that maybe some of the adversity, the barriers, resistance that you're seeing coming up in the Black community, specifically related to receiving the vaccine?
Well, I think, Miller, I think the big thing is the sort of two things come up for me with that question. The first is that the media continues to paint the picture that Black people are vaccine resistant. And, I think it's important to note that that isn't applicable across the board. And the way that the story is written, it sort of suggests that, all Black people are resistant to vaccines. And again, we know that that isn't accurate. The other thing that comes up for me is the equity issue. I spoke with a community leader about an hour before this call to talk about how, we're going to ensure that communities get access here locally. And one, to figure out ways to, better triangulate where vaccine supplies exist and how to get community leaders involved to mobilize communities to vaccination spaces where vaccine supplies do exist. So there's some logistic pieces that I think are connected to that that are continuously being worked on. So those are some of the things I think about. And then also, I also think about, what life was like before the pandemic. And for many people, life wasn't good. It wasn't great. And so sometimes when I hear people say, oh, let's get back to normal, let's go back to, the way things were, what comes up for me is, well, the way things were for many people wasn't great. So we're going to go back to that. So how do we think about and envision a society and a culture that, again, meaningfully and appropriately addresses the rampant and systemic racism that exists in our communities, in our cultures, in our systems, in our institutions, that continue to denigrate and marginalize communities, that continue to result in, you know, negative health outcomes and you know, income inequities, education inequities, et cetera.
Thank you for that. And I appreciate you calling the thing a thing. Thank you so much. Next question. Does the vaccine pose any threat to the fertility of young women of childbearing age? Also, can you speak to the concerns some may have around the idea that the vaccine could be deployed for population control? I've heard many young people give this as a reason for not getting it.
Yeah, I think that those are really, really important points. There's been quite a bit about, again, pregnant persons who can become pregnant, and COVID-19 that's been authored by many authorities in this area. So I'm gonna put some links in the chat that hopefully folks can access.
I see that they're coming into the chat. Maybe we can also email those out to the resources, because that one came in as a link. The previous two did not. Also, I want to just call attention to, I appreciate the language around pregnant persons and people who can become pregnant, and just being mindful of the inclusive nature of that language. So thank you for that.
No, I think that that's important. So thank you for that. So, you know, based on the data, and based on the scientific perspectives, that there is no interaction between the vaccines and fertility. And population control, you know, that is a myth. And it's not one that honestly makes a lot of sense to me, especially when I think about, you know, generally the focus of that is that, you know, the population control is for communities of color, in particular for Black communities. And in many places I know around the country, you know, white people are leaving their suburban homes and affluent communities and learning about vaccination slots that are open in urban centers, predominantly Black and brown community spaces, and going into those spaces and taking up the vaccine slots. So for so many reasons, that to me is inaccurate and is a myth that is important to dispel. But there are practicalities to this as well. You know, if we lean into these myths, then ultimately what happens is that the message becomes perpetuated that communities of color, Black people, are resistant to the vaccine, which then leads to the vaccine slots being taken by other groups, which means that our groups and our communities get left behind, which means that the rates of hospitalizations and deaths in our communities continue to go up. So I think it's really important that we think about this, right? And, you know, get information from trusted sources. Anonymous memes and, you know, videos on the internet and social media should not be used as medical opinion. So those are the comments I have to that.
Fair enough. Thank you so much for those resources and for that. Another question that came up is, can you talk about the concerns around the vaccine, the COVID-19 vaccine, and people with HIV, cancer, and other pre-existing conditions, if you will?
Sure. I can do you even one better, and I can bring up the data Uh, as a researcher, I love data.
Come on with the receipts.
Receipts. So I don't know if it's appropriate for me to share my screen, but I can.
Yeah, please.
So what you're looking at is, so this is the data that is on the Moderna study. It's publicly accessible on the website. If you Google Moderna and study COVID-19 demographics, this should come up. So you will see here that the white communities made up a large proportion of the study participants, but we also see that Hispanic communities represent about 20%, Black communities represent about 10, Asians 4. These numbers are really important. And while on the surface, it may not look like a whole lot, when you factor into the equation, that typically these numbers look 100% less than this in clinical trials generally, particularly for medical products. If you think about the range of products that are accessible at a pharmacy, as an example, many of those products that are on the shelves were tested in studies that did not include any people of color. So what we're talking about here is an improvement in this area, in part due to the work of my colleagues here at the COVID-19 Prevention Network and the efforts of our clinical trial sites to make sure that diversity was a consideration for these trials, recognizing the importance of disease. I will also show, since it was brought up, thinking about comorbidities. So people were included in the study that had underlying health conditions and were also taking medications for these health conditions. So we're not seeing interactions, again, based on the data, between these vaccines and the medications that people may be taking as a result of other health conditions that they may be experiencing, including heart conditions, lung conditions, liver disease, diabetes, obesity. People living with HIV were also included in the studies as well. So I just wanted to show that, and I can put the link for this in the chat as well.
Thank you for that. One of the questions that we had submitted prior was, how long will the vaccine protect us?
Yeah, that's a question that I get often. And it's a question that we're still trying to understand. So I just want to preface my response by saying again that what we know, and the data shows us that the vaccines work really well to prevent severe illness leading to hospitalizations and death. We're still doing the work to find out whether or not they prevent a person from actually getting the virus and transmitting the virus, even if you are vaccinated. So that work is still happening, and we hope to be able to provide some clear answers to that soon. But to answer your specific question, we don't know yet how long protection lasts. This is a very new type of coronavirus. Coronaviruses in general aren't new, but this is a new version of a coronavirus that we're still learning about. And the more that we continue to study, the more we do learn. And the more that we learn, the more that informs how we move forward and, clinical guidance, et cetera. So again, as soon as that information becomes available to us, we will absolutely get it out.
Thank you. Do the Pfizer and the Moderna vaccine protect us from the new variant?
That is a really good question. The data that we have so far says that both of the vaccines work really well to protect against the variant found in the UK, and that the other variants, there's some fluctuations there. So one of the things that I think is really important, to be really transparent here, is that we don't typically see vaccines at 90% or greater efficacy. Like, this is important context. Even thinking about the flu vaccine, typically the flu vaccines range between 20 to 30% up to like 40%, sometimes 50%. And, you know, then some people are like, well, why should I get the flu vaccine if it's not 100% effective? Well, the flu vaccines aren't generally designed to prevent you from getting the flu. They're generally designed to keep you from getting seriously sick if you do get the flu, because many people actually still die from the flu. So it's important that we are protecting people, particularly people with compromised immune systems and underlying health conditions. So we're sort of in that same sort of thought process, you know, regarding how we think about the COVID-19 vaccines. No, the vaccines may not be 100%, but they will be effective at providing protection that's over and above better than no protection.
Got you. So 2 follow-up questions about the flu shot that came in is, 1, will we have to keep getting vaccinated every year like we do with the flu shot?
That is a logistic question that I wish I had an answer to, but at the moment I can say that I don't, because it's connected, Miller, to the question that you asked about the duration of the protection, right? So as soon as we know how long people are protected, then we can think about the frequency in which people should get the vaccine.
Fair enough. You know, we're just trying to stretch your mental horizon here and see what information we can get. I appreciate it.
I'm right here with you.
Look, but I also appreciate that I don't know what I don't know and being very honest about that. So thank you for that honesty. The next piece is, can you get the flu and COVID at the same time?
I guess it is possible to get the flu and to get COVID at the same time. I mean, it would not put you in a very good situation health-wise, but yeah, I could absolutely see you getting the flu and COVID at the same time. I could see how that's possible.
That sounds challenging. I don't even want to think about that. Next question. Do you have any information or knowledge on the LA variant?
I don't. To be honest, you know, I'm still learning a little bit more about the variant first identified in South Africa. There's one first identified in Brazil. And, you know, to be perfectly honest with you, the longer this virus sits in our communities, the more there's an opportunity for additional variants to pop up. So variants are a result of the virus doing what it's supposed to do. It's supposed to survive, and it's going to do everything that it can to do so. So as it replicates in our community through transmission, the replication process isn't always perfect. And that's how you get variants, right? So this is another reason why getting vaccines are really, really important, because they will help to reduce the instance of people potentially not only getting sick, but if we find out from the research that's happening currently that the vaccines do in fact prevent people from transmitting the virus or even getting the virus, that would be an additional benefit above and beyond, again, the benefit of preventing severe illness. So.
Thank you. Thank you. So when getting vaccinated, what information should be disclosed to the medical staff administering it? Do they need to know about all my other medications, drug, alcohol, tobacco use, pre-existing conditions, et cetera?
You know, I think that information may be important to disclose. I think one of the most important things that's a consideration, particularly for the Moderna and the Pfizer vaccine, is whether a person has a history of severe allergies. And you will know if you have a history of severe allergies because you're a person who likely walks around and carries an EpiPen. So if you are that person, or if you are unsure of your severe allergy history, then you should definitely notify the vaccine staff, you know, at the vaccination center that you go to. And what that will mean is that where people who don't have that history will wait 15 minutes for observation after being vaccinated, you might have to wait 30. So it's a 15-minute additional wait. But that is a safety consideration. Again, all of this is about patient safety, really. And so, during that process, if a person does, happen to have any sort of reactions, then one, an EpiPen can be administered immediately, and 911 can be dispatched to do a medical evaluation and to make sure the person is clear. And this is standard protocol for sites that are doing vaccines.
Thank you. So this question, we've heard a lot of rumors about this could have been prevented, or at the very least not have over 500,000 people dead. Could this have been stopped a while ago?
I think in some ways it could have been stopped. It didn't need to get this bad. I mean, there are countries out there that are faring much better than the US. And I think part of it is because of their prevention measures early on. Shutting down, mask mandates and contact tracing were huge tools that resulted in countries being able to mitigate, the impact of this. But, the early implementation of these strategies was challenged and fractured. So I think that contributed to, and in addition to the states not having the resources that they needed to do the real work of, being on the ground in communities, the contact tracing efforts and such really slowed down our collective response, I think.
Yeah, thank you for that. Are there any FDA approved drugs for COVID-19?
So the FDA approval process is a lot more layered. And so I would say no, there are emergency use authorization vaccines, which we have currently 2, and there are emergency use authorization treatments, remdesivir being one of them. But for licensed products, we're not there yet.
Thank you. Thank you. Someone says, I found a COVID shot using the Facebook group, Find a COVID Shot Washington, share it with friends. Is there something that you recommend for that?
I think community resources to, share and make sure that people get access, I think is really important. This is not just a response by the medical establishment. This is an everybody response. The work to support vaccine distribution and allocation, like all of this is literally a whole community response. So, any efforts to share information to help support getting people vaccinated, signing up elders, going to the family members, particularly older adult family members who live alone. All of that work is really important. Holding each other in love during this process, because we're a year in, right? And so I know lots of people are like tired of staring at the walls of their domiciles, right? And trying to, see some change in in what's happening. So we all, I think, have a responsibility in this process.
Yes, social responsibility. We hear that. Question, what is the best practice? 1 mask or 2?
I know CDC guidance at this point is 2, and I think that that's really important. I was talking to a colleague today who had on a mask, and the mask was like a little thin t-shirt material. And I reminded him that of the CDC guidance for 2 masks, double masking. And he asked me why. and my response is because you know, thin fabrics are not enough to prevent you from being exposed to the virus. And he said, well, how do you mean? I'm still having my face and my nose covered. I said, well, yeah, that's true. I said, but if you put your hand in front of your face while wearing this thin piece of fabric and you breathe, if you can feel your breath on your hand, your mask is entirely too thin. And if you can feel your breath through the mask on your hand, that means the virus can come through the mask into your mouth and your nose. His face was completely like shocked. I was like, yeah, this is, you know, we're not talking about, we're not talking about large pieces of molecules. Like, we're talking about microscopic molecules and particles, you know, that are the virus that can enter into the space. And so again, the double masking is really to make sure that people are wearing the appropriate face coverings to prevent their exposure to the virus, and also to prevent people from being able to unknowingly spread the virus, because asymptomatic transmission is happening. You know, there are people who are spreading the virus without having symptoms. So,
and a follow up with that, if we, after being vaccinated, do we still need to wear a mask?
Yes, for the reasons I just described.
Okay. You know, sometimes we need to hear it more than once.
Absolutely. I'm here for that. So please wear a mask after you've been vaccinated. Please practice physical distancing as much as you can. Please continue to, you know, sanitize high touch point surfaces. We are not out of the pandemic yet. We've made some progress for sure, but we are not out of the clear. And, you know, the more we can double down on our efforts now, I think the better outcome we will have moving forward.
Thank you for that. This question is it safe to donate blood if you've had COVID?
I do not have an answer to that question. I do not know. I know that there is blood being used from persons who acquired the virus and developed antibodies, that they call it convalescent plasma. And I know that that is being used. What I do not know is the nuances of how that's done and how to inform a response to, you know, what are the questions you might get asked if you were to try to donate blood? You know, I don't know the answer to that question. So I would say check with, you know, a blood center donations, a blood donation center, because they would likely have updated guidelines, and also talk to a medical provider about that.
Got you. I'm gonna squeeze one more in. Is it true that folks need to have someone drive them to and from their vaccination appointments?
Is it true?
Like, do they? Is that something that people should plan for?
I don't know. So I guess in full transparency, let me also say that I am actually a participant in a COVID-19 vaccine trial. I'm in the Novavax trial, and I've received both I've had both of my injection visits. I do not know yet whether I'm in the vaccine arm or the placebo arm. But I do know that many people are getting vaccinated and they're going by themselves. So I think it's a comfort thing. Like, it would be useful or helpful to you to have someone with you. I think that's important. They may not be able to go through all of the pieces with you as you're going, because of, you know, physical distancing restrictions, et cetera. But having peace of mind is sometimes good for the soul and good for the spirit and good for the body. So if that's a consideration, I would say, you know, to do that for that reason. But, you know, from a medical perspective, I don't think that that's necessary.
Thank you for that. We're going to end it right there. Peace of mind is the real bag. Thank you so much, Dr. Wallace. I'm going to pass it back to Rahel to close us out.
Thank you.
Thank you so much, Dr. Wallace. I am honored and privileged to work with you at Fred Hutch, and also thank you for taking your time to join us on Friday afternoon. I know you are a very, very busy person. We hope today's session has been informative and helpful. For additional information, please visit www.preventcovid.org. For our audiences, if you enjoyed today's session, we invite you to share your feedback with us and join us for our future offerings as we celebrate National Women's History Month in March. You can find that information on our website beginning March. And thank you, everyone, and stay safe. Thank you, Stephaun.
Thank you. I appreciate you all.
Even I can tell you, we're all just doing fine. Just go about your business, simply pay no mind. Believe in better weather, it's only just a matter of time. It's only just a matter of whoa, oh, oh. Cause I won't stop playing no shot. You know I'm saying I only ever trust myself. I only ever trust myself. I won't stop swinging no shot. Although I'm thinking I only ever trust myself. I only ever trust myself. I won't stop playing no shot. Although I'm saying I only ever trust myself. I only ever trust myself. I won't stop swinging no shot. Even though I only ever trust myself. But you can always put your faith in me. You can always put your faith in me. You can always put your faith in me. 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 Always put your faith in me.